Welcome back. So we start off looking at a health matter. The monkeypox virus has spread to 11 states with 74 suspected cases. That's the latest in the news as at yesterday. And that's according to the Minister of Health, who made this known in Abuja on Wednesday when briefing State House correspondents on the outcome of the meeting of the Federal Executive Council. The affected states are Akwa Ibom, Bayelsa, Cross River, Delta, Ekiti, Enugu, Imo, Lagos, Nasarawa, and Rivers, as well as the FCT. Federal government on October 11 confirmed that 33 suspected cases of virus were recorded in 7 states. Monkeypox is a rare viral zoonosis, a virus transmitted to humans from animals, with symptoms in humans similar to those seen in the past in smallpox patients, although less severe. It was eradicated in 1980, however, it still occurs sporadically in some parts of Africa. But the focus of our conversation today is not necessarily monkeypox as much as the effects of the news that went around at one time that it's being spread, how do you say now? There's a conspiracy theory spreading the monkeypox. And so now people who are supposed to get inoculated against certain diseases are not allowing their children to be inoculated. So these are some of the things we'll be looking at today, and to help us discuss this, we have Dr. Ibrahim Adamu, Director of Public Health, Nasarawa State, and Dr. Chima Onoka, Technical Advisor to Executive Director of the NPHCDA. They both join us from our Abuja studios. Thank you, gentlemen, for joining us. So let's begin with you, Dr. Ibrahim Adamu. What's the situation in Nasarawa State? Can you confirm the news, and then what is the situation as regards reactions from the people? Oh, I understand it's Dr. Onoka that is there. Dr. Onoka, thank you for speaking with us. What is your take on this monkeypox situation across the country? Dr. Onoka, can you hear me? Hello, I'm not sure. I guess they can hear us. Dr. Onoka, if you can hear me, could you just
indicate? Okay,
what's the situation, or what's your take on the monkeypox situation across the country?
All right, thank you, Neilta. The monkeypox issue, it's quite, it's one that has raised quite a lot of public concern, and probably because of the pictures that people see, and of course, nobody wants to look like that. But the truth is that at the moment, there have been 3 confirmed cases out of the number you mentioned, the 72, and the Honorable Minister of Health, you know, gave that statistics, gave that information. And then there were quite a lot of suspected cases also for Lagos. And he gave the update that there's no confirmed case from Lagos. So it's still the 3 cases, the individuals that were picked up in Bayelsa. And there's been nothing else that has happened beyond that.
Okay, but for your agency, which is involved in as a National Public Health Care Agency, what should the public be aware of? What information should they be looking at? Yes, you said it's not something that should be scary, that should scare anybody. But you hear about the rumors that it's being spread and there's no cure. So what should the public be looking for?
Okay. All right, now, as you know, the Federal Ministry of Health coordinates the ministry and then the departments and agencies under it. And so on everything that looks like an outbreak and then vaccine preventable diseases where that is the issue, you have the NPHCDA, and then you also have the NCDC working on all of that to help keep Nigerians protected. And somehow you have the teams that have been gathered. Dr. Faisal Shuaib, who is in the NPHCDA, was involved in managing the Ebola response. And then Dr. Chikwe, who is in NCDC, is very well known as an epidemiologist who has, a very great track record. And this is a team that is working to protect Nigerians. Now, all that we do, it's around prevention and then limiting the potentials for problems to happen, and then, mounting effective response, and then, of course, raising the awareness across the country. And that has been going on. So from the MPSCDA aspect, there is a lot of information going out to see that people are protected, and that people are protected in terms of getting informed. And then we also know as well that monkeypox itself is something that we don't have the cure, and you don't have a vaccine, even though like the smallpox vaccine is known to be effective, but that's not available for public use. But what is going on is that we're giving information to everybody. Look, the first thing is nobody should panic. We should all just calm down first. That's the first control measure. We should calm down. Yes, we know that there's that transmission that happens from the animals, especially the rodents, to humans. But human-to-human transmission is very low. It's not even like measles. It's not like chickenpox. It's not like so many of the infections that we know. It's so limited.
Noka,
and maybe that also explains the figures that we have.
You mentioned
even when you go beyond it.
You mentioned the pictures that are out there. And if you were in the shoes of the people, how would you react if nobody's telling you or explaining what you're explaining now to them?
Yeah, I mean, we have a very active social media space. And that's important, While we have such pictures, what we're doing is that we're trying to communicate positive information as well. You're seeing this, but just remember that we've had 3 confirmed cases. That's a lot, really, if you look at it as a disease that we didn't have, before 22nd of September. But then, if we panic based on the picture, it's not going to help us. It will generate some of the things that have happened, and the effect may even become worse, because people are looking at it and now linking it to immunization for measles, for polio, for all of that. And it's causing more harm than good, which is unnecessary.
Dr. Noka, if you can just hold your thoughts, we'll take a moment and we will come back after this short break. Please don't go away.